Hello, this is Vince Lara, Media Relations Specialist at the College of Applied Health Sciences at the University of Illinois. Today I spend a few minutes with Dr. Sandraluz Lara-Cinisomo, Assistant Professor in the Kinesiology and Community Health Department of AHS, to talk about her recent study on the effect of mindfulness on caregivers of veterans. Dr. Lara-Cinisomo, tell me about your research and what inspired this project.
Well, I focus on mental health disparities primarily in women, and that includes low-income women, immigrants, and women affiliated with the military, and now more so with veteran populations. Prior to coming to the University of Illinois, I worked at the RAND Corporation, as I mentioned, and there I worked on projects related to military spousal well-being. We looked at stressors, how they were coping with deployment, and I recently also completed a study looking at employment trajectories of active and reserve service member spouses, mostly women. And so when I arrived at the University of Illinois, there was a call for focusing on veteran populations. And given the number of veterans we have in today's society and the number of veterans that have survived the 9/11 conflicts, I thought it would be important to look at the caregivers working with them, most of whom are spouses.
What challenges do you face when you're recruiting for a project like this?
Well, let me just describe the project a little bit. It was a mindfulness intervention, and the objective was to determine its effectiveness at reducing depressive symptoms, anxiety, stress, and worry in caregivers. And I expected that most of them would be women. And so what inspired me was an interest in identifying an intervention that would help improve the mental health outcomes of those caregivers. The RAND Corporation put out a report titled Hidden Heroes, which focused on the caregivers, and it highlighted the psychological effects of this long, complex caregiving that they're giving veterans. And so I thought it would be important to provide services to that population. Now,
do you see potential collaborations in this line of research, especially with regard to mindfulness?
Absolutely. The work with the Chess Foundation, the Chess Center here would be helpful in building those collaborations, but also in working with them because we do target veterans in that center, but also this region has several hundred caregivers, but also veterans. And really, there are more veterans than caregivers. And so there are opportunities for working with organizations that are interested in supporting not just the veteran, but those who are caring for them. Now, these are informal caregivers, most of whom are family members of the veteran who are not getting paid for their services. And so they're providing care in the context of other roles, whether it's parenting, attending school, maybe have a full-time job, maybe they're transitioning out of full-time employment and transitioning into retirement. It's a huge life phase change for them as well. So there are opportunities for working with a number of organizations, both federally funded and also nonprofit organizations that are interested in veteran and caregiver outcomes.
Do you see potential offshoots in both areas? In other words, you could look at caregivers and other mitigation tactics, right? And you could also look at mindfulness and using that to mitigate other issues, correct?
Yeah, so mindfulness has been shown to be effective at reducing stress and depression, and we found that mindfulness was helpful in reducing, as I mentioned, stress, worry, and anxiety. Those were the 3 of the 4 areas. We didn't find high depressive symptoms, and so there wasn't a lot of room to reduce those concerns that maybe subjects or participants had. So we know that stress is a huge factor in this population. And so there might be opportunities to identify other interventions that also help reduce stress. Exercise, yoga, psychotherapy, medication. But because this population is highly strained and has very limited time, we thought that it'd be important to identify an intervention that they could take home with them that would not require ongoing treatment. So the intervention was an 8-week program where subjects came for 2 hours, received instruction on how to practice mindfulness, but they also received instruction on what is stress and how to reduce their stress, how to pay attention to their bodies, how to pay attention to their reactions to things. And these were things that they could practice at home. And in fact, they were required to do so. And we did show, we have another paper that was recently published that showed that there was a significant change in awareness and self-observation, which are key components of mindfulness. And so these are now tools that caregivers have that they can take home with them, that they can practice, they can share, they can teach, and they can continue throughout their life. And it won't require another doctor's visit, for example. Now they should continue their own health care, but this is now they're equipped with a resource that they can have for the rest of their lives.
One of the things I noticed about your study was that you had excellent retention. What do you attribute that to?
Well, I had excellent research assistants, and the way that I do my work is that we really try to personalize, without compromising the design of the study, personalize our interactions with our subjects. We let them know we care from the beginning. And so, for example, if a participant missed a session, we had very standardized language that we would send them an email and say, we're sorry you were unable to attend. Please remember to practice these sessions. We look forward to seeing you. Here's when the next session was going to take place. So we had ongoing communication, and often those participants would respond to our email and say, here's why I wasn't able to attend. Thank you for your email. We'd say, we appreciate you remaining engaged. We look forward to seeing you at the next training, which is happening at this day, at this time, at this location. So we remained in contact with them whether or not they participated for that week.
So researchers are always working on their next projects, right? They're looking for the next thing to study. And so what are some of the things that you have coming up that you're really excited about?
Yeah, so I'm excited about scaling up this intervention. So our sample was very, very small, very important, but small. And so we need to replicate the study with a larger sample. We also know that physically driving to a location that might be an hour away is not feasible. So we're looking at other approaches to providing mindfulness for caregivers, and then also having a comparison arm to confirm the effectiveness of the intervention.
My thanks to Dr. Lara-Cinisomo. This has been A Few Minutes With.